Hi, Dr. Publicker.
Hi, Stephanie.
You have decades of experience in this area. Might you please share a brief story about someone who is in long-term recovery and then had a recurrence of symptoms after they were prescribed opioids or benzodiazepines for a medical situation?
Unfortunately, this is not a rare circumstance. I had one patient, Jason, who I'd been treating for a long time. He had 5 or 6 years of very, very strong 12-step recovery. Suffered a number of losses. He had a job loss, had a divorce, and developed a severe anxiety disorder. He was having trouble leaving his house, and his physician, not knowing about his sobriety, prescribed him alprazolam or Xanax. This was originally intended to be a short-term treatment. However, because of his tolerance due to his alcohol dependence, he rapidly needed to take more. He lost control and kind of tragically found himself having to resort to buying Xanax illicitly. The shame was enormous, and it caused him to distance himself from his 12-step recovery group and hide his addiction to benzodiazepines from others. In the course of this, he relapsed back to drinking. Finally, he was able to overcome his shame, was able to have a conversation with me about his problem, led him through a process of detoxification from Xanax, which, by the way, is a difficult process. Got him back into his 12-step program. I treated him with naltrexone for his alcohol craving, and subsequently he's been doing well for several years now.
Wow, that's a really great story that illustrates this concept very well. I'm sorry to hear that that happened with your patient, but I'm so glad to hear that he's doing great at this point. And as we think about your patient that you just described and that tragic story that ended very well, what is the role of medical ethics in caring for people like him or any person who's in long-term recovery?
Right. I think that medical ethics are the cornerstone of treatment for all medical disorders. First principle is beneficence, or do well, act in the interest of the patient. In this regard, I think it's important for us to examine our beliefs, how that may stigmatize a patient and deny the patient proper care. And beneficence also involves providing our patients with compassion and recognition of their need for care. Autonomy is a second principle, and that relates to respecting the person's wishes and desires in terms of their treatment. And the final principle, which I think we've all heard, is non-malfeasance, which in fact means do no harm. And again, we're looking at our beliefs, how we express ourselves, both through body language and through language, to give people a safe harbor for which they can seek treatment.
Those principles are so important for us to keep in mind, incredibly important, and really important when we think back to the care of that patient that you described at the beginning of our conversation here and how important those pieces are to his care. In the first video, we watched Pat and Sean have a conversation about recovery, and we heard how important it is for people in long-term recovery to disclose this to providers. We imagine for many providers, responding to this feedback might make them pretty uncomfortable in some situations. Can you share with us today some simple things you'd recommend that a healthcare clinician can say to a patient in long-term recovery?
I think that the first thing I would say is thank you for sharing. And what does your recovery mean to you? What are you most concerned about? Especially, what are you most concerned about in terms of how I might be treating you for different conditions? Let me, in advance, let you know that I am completely open to respecting whatever you wish, and I'll let you know my advice in terms of things that might be best interest. So how can I support you? How can I better understand how your treatment can either assist you in promotion of sobriety or potentially may harm you?
Such important questions to have in our armamentarium and in our toolbox. Really incredible. We also know that there are some preferred and non-preferred options to use in various situations. For example, cyclobenzaprine is preferable to diazepam if muscle relaxant is required, particularly in a younger patient. We would want to consider different options in an older patient. One important and underutilized resource for clinicians in this area is their local clinical or community pharmacist. Pharmacists can work with a clinician to help optimize pharmacotherapy for patients in recovery and are often just a phone call away. Additionally, we know the importance of expression of care, concern, respect, and love. And all of those things you expressed very articulately earlier when you were describing that patient situation. Equally important is terminology and word selection in achieving positive treatment outcomes. When stuck, we can always refer back to our dictionary to help us find the best phrase or term. Well, we have covered many topics in a short period of time. In closing, what other words of wisdom can you share with us today, Dr. Publicker?
Well, first, I want to appreciate, Stephanie, your comments regarding compassion, respect, and care. I think those are cornerstone principles that apply to all medical conditions, but especially to those that are stigmatized as substance use disorders. Suffering patients rarely know that there are medications that can help relieve their craving and compulsions to drink, despite their desperate wish not to. I assure you, there is nothing more rewarding in the practice of medicine than assisting people in gaining solid, stable sobriety. Really recommend that you take the time to research information about medication-assisted treatment of alcohol dependence. There are a number of medications, and there are a number of places that you could learn about these medications, one of which is our bibliography that we provided you. And the other is to go to the Lunder-Dineen website. We have a lot of information at the Time to Ask site where you can learn about these medications.
Well, thank you for this fantastic conversation today, Dr. Publicker. I know I learned a ton, and I'm sure our audience is learning a great deal as well.
You're very welcome, Stephanie.